Hello, thank you for watching. I'm here with Adrian Crane, Medicare specialist. My name's Jonathan Burgess. I'm with Big Money Management, the owner of Big Money Management here. And today we're going to be talking about Medicare. And the reason that we are is because I get the question a lot, Jonathan, what do I do about Medicare? What is up with Medicare? And it is definitely a complex subject. So whenever you have a complex subject like this, what do? You bring in the expert. So that's why we've got Adrian here. Literally the name of the company is the Medicare Specialist. He's been doing it for about 4 years now. Yep. Definitely most professional guy I know in the business.
Oh, thank you. Thank you.
So yeah, he's going to break it down for us. So first question, and I'm going to start very basic for everybody. What is Medicare?
It's a very big subject, obviously, and it's complicated, and there's no Medicare orientation. It's not like you go to a class, especially when you're 65, to learn about Medicare. The government, the United States government, actually sends people a book when they're approaching turning 65, and it's this thick, and it nobody understands it. Nobody knows what's going on. You can try to digest some of it, but it's pretty complicated. And what Medicare is it is a social security program, and we pay Medicare taxes. You have to pay into it for about 10 years to be eligible for Medicare when you turn 65. Some people are eligible that are younger if they're disabled or have certain conditions like kidney disease, but for the most part, people are eligible at 65.
So it's pretty much like government.
It's government and health insurance.
Okay.
Is what it is, and when you have it, if you had nothing else, the way it would work in a nutshell is you have two parts. You have Part A and Part B. Okay, Part A is hospital insurance. Part B is outpatient insurance, going to the doctor, durable medical equipment like a wheelchair. Medicare A and B does not cover prescription medications. So when you have A and B, you pay a premium. Mm-hmm. Okay, it's $148.50 a month in year 2021. Uh-huh. That premium goes up every year because Social Security, they assess costs, and it's just like inflation. Things get more expensive. So next year, it's going to be, I'm pretty sure, $157.50.
Okay.
So premium monthly.
Okay. So before we go into all the moving parts, why it's so important that you watch this right now, and if you're watching this right now, share it because we're live right now on Facebook. Open enrollment starts tomorrow.
Actually, marketing of new 2022 products starts tomorrow. Open enrollment for Medicare starts on the 15th of October.
Okay.
So tomorrow would be the first day that there are people, the public and agents are allowed to talk about what's available in 2022.
And beyond that, not a lot of people do it. So you don't really have a couple things. You don't have the education rolling up to it, especially if you're 64. Like you said, they're getting a book on how to do it. They have no one to walk them through it. So what we're going to do in this video is we're going to walk you through each part. I'm going to ask some of the most common questions to Adrian, and then he's going to give us the context that we need to be able to make educated decisions. Because at the end of the day, this is like one of the, as I approach all retirees, they're like, Jonathan, what the heck do I do about Medicare? So I'm super happy to have you here.
You turn 18, you turn 21, you get married, and you go on to Medicare. It's like we always joke about it. It's like a stepping stone in your life, and it's amazing how little known people don't understand what it is and then what to do. So
right. Okay, so walk me through. So part A and Part B.
Usually I do this on a whiteboard because visually it's easy to understand.
Yeah.
Obviously, but you've got two parts, A and B. You pay a premium to have essentially both of them. But the premium is called a Part B premium. Part A doesn't have a premium if you worked long enough, which most people have.
Yeah.
Part B does have a premium. And Part B's premium is $148.50 a month. That is a premium you pay to Social Security, not an insurance company. And then you've got a Part A yearly deductible. So you have a hospital deductible that's yearly. It's $1,484 in 2021. So if someone on A and B were to go to the hospital, they would contribute to that deductible. Once they meet that hospital deductible, then Medicare pays 80% of cost, and you pay 20% of cost for hospital insurance purposes or whatever you're doing in the hospital. That 20% that you are billed, there's no cap. So
Okay.
from a risk standpoint, it's an unlimited amount of money you could be billed from the hospital system would actually bill you, because Medicare is paying 80% of that hospital bill after you meet your deductible, and now you're paying 20% to that hospital.
Okay, got it. So part A and B are together. You're
Right.
not actually paying a premium for part A. You're
Right.
paying a premium for part B.
Right.
But the part B is deducted from your Social Security.
Yeah, most people set it up that way, or you can, write a check quarterly, or you can pay online. You can create an account on Medicare.gov and pay, with a credit card or debit card.
And that has to come out of
Okay, the Part B premium, if you want Medicare Part B, you have to pay for the Medicare Part B premium.
Oh, okay.
There's no option for not paying it unless you just don't want Part B. So you cannot have Part B. You don't have to have Part B. You can opt out of Part B and not have it. And who would do that? People that are still working, that have employer coverage.
Yeah.
That is cheaper than what they would be paying on Medicare. People that have TRICARE for life, they have to have Part B too. Maybe certain circumstances, pretty rare, where maybe they just don't believe they need health insurance, Medicare health insurance, even though they pay tax into it. It's very rare for someone to opt out of Part B without having something else in place. But Part B is your outpatient. It has a deductible. It's $203 a year in 2021. That deductible is going to go up next year, just like the Part A deductible.
With inflation.
Yeah, right.
Right.
So the outpatient deductible, Part B, someone would contribute to that $203 when they go see their doctor. After they meet that deductible, however long it takes, then they, for the Part B costs, are going to be billed 20%, and Medicare is going to cover 80%. So those two deductibles don't commingle; they're separate. If you meet one and not the other, it doesn't matter. You have to contribute to both, and once each one's met, then you're paying 20% of costs, no matter how large you get. So people will say, well, I mean, how big could 20% get? Well, imagine you have end-stage renal disease, and you get injections every week, right? Or I guess blood transfusions or whatever they do. That is going to fall under Part B. Well, that is one of the most expensive long-term care treatments that you can have. And once you meet that $203 deductible, you're paying 20%, or you're at least being billed it. Whether you pay it or not, that's up on you. But you will be billed that 20% for the remainder of the year, and that money is unlimited, and however expensive it is 20% to you.
So like if they had $100,000 hospitalization cost,
and you met the deductible already, it's $20,000.
Oh, so that can get expensive for a retiree.
Yeah.
Yeah.
I mean,
so beyond Part A and Part B, is that where the
that's
other
where
parts?
we come in.
Okay, all right. Great. So before we get
Yeah.
into that, let me break this down. So if you're watching right now, the way that Adrian has explained it to me, you've got Part A and Part B. Part A is the side of hospitalization, right?
Hospital insurance.
Hospital insurance.
Government hospital insurance, so to speak.
And that one's 80/20.
80/20 after the deductible.
Okay, once you meet the deductible, and then Part B is you have to pay that premium, and that's for outpatient. And there's a $200 deductible on that side.
Yep.
Okay, that's
Correct.
not too. That's
It's not that
too,
complicated.
No, it's not too hard.
It's really not.
Yeah.
I mean, compared, and it's for everybody is the same, unless you are a high income earner. So
So define high income, because that's relative.
$88,000 a year. I think it's gross modified adjusted income. I'm not a tax professional or an accountant, but essentially the IRS is going to look at somebody on Medicare, and if you're just a single individual and you made $88,000 or more 2 years prior, they're going to adjust your current premiums based on that 2-year prior tax file. And if you are above that threshold, you're going to pay more for your Part B premium, and it goes in brackets. So it may go from, I don't remember the brackets exactly off the top of my head, but basically from 88,000 to probably 115, you pay an extra certain amount. It may be around an extra $55 a month for your Part B premium. And then every $20,000 or $30,000 increment, you're going to be assessed a higher Part B premium.
What's the highest?
I think the highest is $530 a month.
Yeah. But you would have to be like
making $750,000 or more
as a retiree.
That's
great.
On Medicare.
That's big money.
Yeah, I mean, it gets expensive. And that's just your Medicare premium. You get assessed another adjustment too for drug coverage. So it can get, for someone that is making over $750,000 that wants the Cadillac of insurance, I want the best money can buy kind of thing, they'll probably be paying somewhere in the $800 to $900 range a month.
Got it.
In premium.
Okay, cool. So let's go back. We have Part A and Part B. Part A is your hospital, and Part B is the outpatient. Got that piece.
Right.
Okay. So now we get into so that's just general government insurance. And then why would someone come and see you? What are the next steps? Because it obviously gets more complex after that.
Yeah. So when I meet somebody, I try to help them understand what Medicare is, just like that. And then once they understand that to a degree, they would say, okay, what about drugs? Well, Medicare does not cover, A and B doesn't cover prescribed medications. A injectable like chemo, a treatment that you would receive at a facility, that's outpatient, so that's covered under Medicare, at least 80% of it after you meet your deductible. Prescribed medications that you go to a pharmacy and take home with you are not covered by Medicare, so you have to enroll and do something called Part D. So Part D is in drug. That is a health insurance plan or a drug plan that's going to be available to consumers, sold to them by private insurance companies.
Okay.
And those plans, there's quite a bit of them. They cover prescribed medications for people, and they all have different formularies. So some plans are better at covering certain medications better than others. And so what I come into play when I'm trying to help someone decide, what type of drug coverage they're going to have, it is completely based on their medications, because it's not like car insurance where you have a lot of options. In Greenville County, for example, there's probably only 27 drug plans that someone could choose while they're on Medicare. And that's all that they have access to. They can't decide. Now, they could just not have drug coverage and use GoodRx, which is like a private, it's not insurance, but it's something that people that aren't on Medicare have access to. I could use GoodRx. It's like a coupon. But they're limited in what they can choose. So from my perspective, it's not about the company. These are highly regulated plans by the government. And so I trust all of them. It's really based on your medications. Who's going to give you that drug coverage for the medications you take for the cheapest price? And that can be found out in about 5 minutes.
Oh, that's awesome. So Part D's part drug.
People, drug. That's your drug. Yeah. So they would need drug coverage.
Don't take too many drugs.
Right.
In retirement, you'll live a shorter life.
Yeah, maybe. And then people say, well, what about that other 20%, that hospital and outpatient 20%? What about that? People want to cover that.
Right.
And so, after you get your drug coverage situated, then you would start looking at something called Medicare supplements.
Okay.
and I sell that as well. And that is going to be a private insurance company sells a supplement to someone on Medicare to supplement what Medicare doesn't cover.
Got it. That makes
And
sense.
you know, and that those three pieces, your Medicare, your drug coverage, and your supplement, that's a very common place to be for people that have the means to pay premiums. Because that's what I would consider the Cadillac of health insurance at 65, because there is nothing else that you could go purchase and pay more money than that situation right there. That is it. The only other place to go besides Medicare and a supplement and a drug plan is something called Medicare Advantage. And that
I've heard of those.
That's a totally different type of health care. And I think before I went into that,
let's hit Medicare supplement.
yeah.
So break that down for me a little
So-
bit. What is Medicare supplement?
Medicare is stagnant, if you will. It's the same for everybody.
Okay.
Maybe the premiums are different for people that make more money, but the coverage, the way the coverage works, doesn't change based on your income and resources. Only the premium. So you would get a supplement after you get your drug plan. You choose your drug plan. That's pretty easy. Then you get your supplement. Well, when you look at Medicare supplements, you got a couple different factors. Number one, there are hundreds of insurance companies that sell supplements. So to me, how do you choose a supplement? It's based on where you live, because carriers target specific markets around the country. They can't all be the cheapest everywhere. They would go out of business. So around the Southeast, I would say in Georgia, South Carolina area, Aetna and AARP, United Healthcare, dominate the supplemental market based on their rate and a company that is has a good financial rating.
Right.
So supplements are standardized. You could buy a supplement from State Farm and Aetna, and it's going to operate exactly the same. The government standardized them in, I think, 2005 to make it easier for seniors to understand what they were buying. Because before that, this supplement over here offered maybe some dental, and this one over here maybe didn't give as much coverage as this one over here, even though it was both called Plan G. So it was very confusing for people. So what happened is they standardized the plans. So a Plan G supplement, if you buy it from anyone, it operates exactly the same. Same with a Plan N or a Plan F. There's no difference. It's only the company you buy it from and the premium that you pay.
Got it. But
So-
that supplements the 20%.
How does it work?
Yeah.
So let's say you bought a Plan G. That is what people today, if you turn 65 after January 1 of 2020, Plan G is the that's the best money can buy. That's what people always say. They say, people with a lot of money, once they trust me, they may say things like, I don't care, this is how much I pay right now. They're kind of expecting maybe they're going to be paying like $1,000, $1,500 a month. And I'll say a Plan G is the most robust supplement for Medicare. And around here, you're going to pay about $100 a month starting out. And what it's going to do is that Plan G is going to eliminate the Part A deductible. So that hospital deductible goes away. And then if someone were to go to the hospital with that Plan G supplement, they would have no bill, because your supplement is going to pay that remaining 20% immediately, and the deductible is wiped out, the Part A deductible, and there's no limit. So Medicare is going to cover 80%. That remaining 20% is going to be covered by your Plan G supplement, no matter how large it gets by law. It has to be covered.
Is that tax deductible whenever they?
No.
No.
Not, not supplemental. So Medicare premiums and medical, not the only thing that is not going to be either tax deductible or you can't use like a HSA to reimburse yourself for is supplemental premiums.
Okay.
Drug costs, copays, Part B deductibles, Medicare premiums, those are sometimes deductible. And I say sometimes because it depends on if you have an HSA. It depends on your income.
Yeah.
Because I'm not a tax professional, but
I knew that was coming.
I mean, I know that there's a certain amount of money your medical expenses can't be more than a certain amount. Relative to your income, something like that.
Okay.
So
I got it. I got that piece.
Yeah.
Okay. So the Plan G gets rid of the whole 20% from the Part A, which is the hospital piece. It's not tax deductible. They pay in premiums, and it covers 100% of that. And it's usually like $100 a month.
Right. The only deductible you have to still contribute to is the Part B deductible.
Got it.
And that
man, you break this down really easy. Please share this. If you're watching this right, please share this.
It's head spinning for people. I think.
So how do when do people start planning for this?
So
64.
The way that I market to people, I think most people reach out probably 5 or 6 months before they turn 65. Sometimes earlier. Most people that reach out, most people don't call me and say, "Hey, I'm turning 65 in a week." Because I think most people that are willing to call an agency or a broker to ask questions are also, a little conscious about this upcoming date. Or some people delayed Part B because they still work. And a lot of people will call and say, "Hey, I'm still working and I have employer coverage and I do also have Medicare Part A, but I need to learn about Medicare Part B and how this is going to work if I choose to retire in 5 months." But for the most part, I would say you need to start pre-planning probably 4 or 5 months before Medicare goes effective for you.
Okay.
And I say that time frame because you really can start to make decisions about what you're going to do within that time frame.
So break down open enrollment, because then open enrollment starts the middle of this month. You can start marketing for it
Right. So
tomorrow.
Open enrollment is a period of time for everyone on Medicare to make a change. Their drug coverage, their Medicare Advantage plan. Supplements are not restricted to open enrollment periods. People can make supplemental changes throughout the year if they want to. Open enrollment is really just a time for people to compare drug costs with Part D, or if you have Medicare Advantage, you're comparing different types of Medicare Advantage plans. For people because I get this a lot though, people will think that they have to wait till open enrollment to get into Medicare for the first time. But people turn 65 in February and March. When you get into Medicare for the first time, you have an initial election period where you have a big window of opportunity to make a decision on what you're going to do with your Medicare.
How long is that window?
It's going to be, it depends on when your Part B starts, but it's about 7 months because you have 3 months before. It depends. Supplements are different.
Oh, okay.
Each piece is regulated, I guess, by a different entity. Supplements, you can enroll into one 6 months before it goes effective. But prescription drug coverage, you can only enroll into that 3 months before your 65th birthday month or when your Part B goes effective. And then you can also enroll into the drug plan if maybe you forgot or just didn't do it. You can use your initial election period 3 months after your birthday month.
Got it.
So it's a pretty big window.
So open enrollment is from October 15th to when?
December 7th.
Okay. So you're very busy during that time.
And it's also, open enrollment for people that are younger.
Yeah.
Their period starts November 1st. So you got this month where people on Medicare can make changes and then they overlap. Then you get people that are younger working people that enroll into different plans. So it gets pretty hectic like right now.
Yeah.
I mean, for the remainder of the year.
So where should someone get started? Like if they're watching this right now and they're like, okay, Adrian, this makes sense. seriously, he is the most professional guy I know in Medicare. If they wanted to get started, what do they need to do to reach out? What is that process like if somebody calls you? How does that look?
The way I operate is we set up an appointment where it's educational. It can be either on the phone, Zoom, or in person at your home or in my office. And I try to help people understand what Medicare is and then the path they're going to take. You know, are they going to go the supplemental route? Are they going to go the Medicare Advantage route? Just a general conversation. I think most people like that. They don't want to come in and make a decision the first day, and I don't blame them because they're just trying to learn. And that conversation for most people, I think, happens 3, 4, 5 months out.
Got it.
And if you're working and are already on Medicare, but you just delayed, you can really have that conversation whenever you want because you get a special election period when you either quit or lose your coverage because you were fired or you were forced out. Those people can immediately enroll into Medicare. So those people, why you would stay with employer coverage versus Medicare would be the cost. If your employer coverage is just amazingly cheap, some of them are, some of them aren't, you would stay with your employer coverage or go with whatever one's cheaper.
Got it.
For the most part.
Okay, I'm gonna hit a light question, then we'll get to a hard question.
Yeah.
Because what I did was I reversed. If you're watching this right now, I reversed searched the Medicare questions. So these are the most commonly asked questions. Can Medicare take your house?
No.
Okay, great. Okay, that was. I don't know why that was a commonly searched one. Okay, all right. And then
But do you want to know why that's asked?
Because Medicaid
Because
can.
Medicaid has something called Medicaid spin down.
Yeah.
And Medicaid will take control of your assets before Medicaid pays for any of your things. That you have to have a certain amount of assets.
That's like long-term care and nursing facility. That we're talking about general health insurance right now.
Yeah.
But Medicaid is if you're extremely
It's going to be ultra low income.
no assets.
No assets.
Yeah. Okay. All right. Good. And then what is Medicare Advantage?
Medicare Advantage is very similar to the type of health insurance people have while they're employed. It's HMOs, PPOs. It's like
What's an HMO or PPO?
Networks of hospital systems.
Okay.
So think of a Medicare Advantage plan would be like a contract. And you sign the contract, and in this contract, you have predictable co-pays and co-insurance, and maybe even premiums, and maybe ancillary benefits like dental, vision, hearing, and transportation. A lot of things to make it a holistic plan for someone, not just giving them medical coverage, but there's
whole
more.
nine.
Yeah, your mouth, your eyes. If you can't drive, people can't drive themselves to their doctor appointment. Some of them have transportation, all kinds of things, and drug coverage is included. So it's like one card, one plan for everything you do. You still have Medicare. You still have to pay Medicare premiums. But think of it like Medicare is going to hire Humana to be the subcontractor for your health insurance now.
Okay, all right, I'm following.
According to the contract that you signed and enrolled into. And that is very, very popular, very, very popular. It's probably more popular than supplements because most of them don't have premiums. You literally don't pay a premium to have that. Like there's no premium. Where you still pay the Medicare premium, but you don't pay a premium.
How?
Because my theory is, so people say, oh, if I don't pay a premium, what's the silver lining? And the silver lining is you have co-payments. So you've got a pool of people, and let's call it Humana plan. And you got 1 million people in it. And Medicare is paying this company 1 million times maybe $2,000 a month to take care of all these people in this pool. So Humana's a bank, and their objective is to retain as much money as possible. So they have actuaries come up with a plan, and inside the plan, you don't have a premium because they know people don't want to pay premiums. And the competition between Humana and all these other carriers, there is no premium because people don't want to pay premiums. So
the co-pays are
the co-pays is how the company collects it.
It's like reverse.
Yeah, it's
health
like
insurance. You're not paying premiums, but you're paying copays.
right. It's like, yeah, they make up for it. You know, the premium, that's irrelevant to me because they make up for it. You know.
Well, it sounds like to me, if I were 65, that I would do the reverse, which is pay the premiums and plug all the supplements in.
So I always try to advise people, if they have the financial resources and believe in buying supplements, to do that first.
Okay.
Because when you get a supplement, you are not underwritten. There's no underwriting. So you could be you could have cancer right now receiving treatment, and you get your Medicare eligibility date and you get a supplement, and you could get the best supplement there is, Plan G, regardless of your health. But if you get Medicare Advantage first, it's a lot harder to go to a supplement later because you get a 6-month window to get a supplement when you first are eligible for Medicare. And after that, it's over. Now, every time you get that supplement, you're underwritten, like life insurance.
Oh, okay.
Whereas Medicare Advantage doesn't underwrite you, ever, now or in the future.
Yeah.
No pre-existing conditions matter. You can pick and choose whatever you want. But the supplement is, you really get a one-time deal where you can get one without being underwritten. Now, people that are really healthy later in life decide, oh, I don't like Aetna anymore.
Yeah.
I want Mutual of Omaha supplement. They can apply for it, and if they are medically underwritten and accepted, they can get it. So I think I try to tell people, if it's something you believe in and can financially afford, you can always leave the supplement. You can go to Medicare Advantage, which is more of your pay when you use the healthcare type situation. But going back to the supplement is a lot harder to do if you have health conditions. So
awesome. Look, man, that I
Wild,
honestly,
isn't
no, it was good. I learned a lot from that. I mean, so you know, I really appreciate you coming on. Number one, I feel like you broke this down really well.
Yeah.
So if you're watching this right now, share this video. If you know someone who's 64, hit that little share button and send it to them. DM them the video. Adrian, if you want his contact info, DM me. I'll shoot it over to you. Open enrollment starts on the 15th, so probably be a good time to go ahead and start talking to him. I already know a ton of people that I need to have call you, but
we're ready.
Thank you, man. I appreciate it.
Appreciate it.
All right, y'all check out the next one. Thanks for watching this episode on Big Money Management. Make sure to subscribe to the YouTube channel, hit the notifications button, turn them all on, and we'll see you next time.